I'm Dr. Julie Dobbs from Animal-Oasis-of-the-Rockies, and today I would like to help you better understand cancer in dogs. My assistant Lisa will help out by asking me some questions, and I hope you're able to learn more about dog cancer, and particularly if your dog has recently become diagnosed.
Dr. Julie, is cancer in dogs common?
I'd say yes, but when we talk about cancer, I mean the medical biological definition of cancer is any abnormal tissue growth. So basically, during this presentation, I'm going to talk about the more serious forms of cancer, so something malignant or metastatic, i.e., something that's going to spread to other parts of the body or become invasive.
What are the common types?
Yeah, I'd say the most common, most concerning type of cancer that we see the most is probably mast cell tumors. So those are some of the most common skin tumors in dogs. Other things that we can see would be like bone tumors, so osteosarcomas. We can also see splenic tumors like a hemangiosarcoma, mammary tumors as well. Then there's other, more rare ones that we might see like lymphoma, bladder tumors, brain tumors, squamous cell carcinomas, which are another type of either bone or gum tissue or skin tumors as well. So, but I think overall, I'd say like mast cell tumors and spleen tumors and bone tumors are probably the most common ones.
Okay. What are some signs and symptoms that my dog may have?
Yeah, so lumps and bumps. So that's why every time we come in, we always try to point out any lumps or bumps that your dog might have. So definitely like the most common, like, benign growth that we see are fatty tumors, but that's why your vet, whether it be me or another vet here or pretty much anywhere you go, is going to offer what's called a fine needle aspirate just to make sure that we know what we're dealing with. Other signs would be like loss of appetite or thirst, pain as well, or limping, especially in those bone tumors, swelling, like big lymph nodes, things like that, non-healing wounds as well. And really, the uglier it looks, the more asymmetrical it looks, the faster it's growing, the worse it's going to be.
Okay. Why is early detection?
Yeah, so especially if cancer is localized to one small area, if we do like let's say surgery on that one spot and we remove it before it's spread to other places, that could save and prolong their life. I hate for animals to come in and they have a bunch of lumps or bumps, or they're already not feeling well and they've lost a ton of weight, and then at that point, if we find a source of one tumor but it spread to other parts of the body, then then we're talking about quality of life or sending you to an oncologist for chemo and radiation therapy. So getting it early, getting rid of that source of cancer is definitely key.
Okay. How will a veterinarian diagnose cancer?
That is a great question. So like I alluded to before, fine needle aspirates was just where I stick a small needle into the area, try to get a couple cells out and look at it under the microscope, is really a really good, cheap in-house test we could do. That test isn't perfect. Sometimes I get nothing. Sometimes I just get blood. But generally, the more concerning, the more common types of cancer, we can at least get a couple suspicious looking cells and then go from there. Really, the most definitive way to diagnose cancer is to do a biopsy. So, a biopsy is different than an aspirate in that we're actually taking a chunk of tissue and then submitting that for a board certified pathologist to look at as a whole versus just a couple cells on a slide. So, that's really the best way to actually diagnose cancer. Otherwise, you're looking at doing surgery, removing the whole mass, and then sending that whole mass off for a pathologist to look at. That's really the most definitive way. Other things too, x-rays, we can always get a really good suspicion if we see lesions in the lungs or a really big spleen or something taking up part of the abdomen can definitely be signs of cancer.
Okay. What treatment options are available for dogs with cancer?
Yeah, it really depends what the option or what the type of cancer is. If it's something on the skin, then we can hopefully just remove that. If it's something where it's already spread, then we're looking at either doing long-term steroids, which can really help suppress the spread or the symptoms of cancer. Otherwise, you're looking at seeing a board-certified veterinary oncologist. Veterinary oncologists are a little bit different than in humans. They're not trying to actually cure the cancer, so to say. They're just trying to help stave it off, keep the pet happy and comfortable. So you're looking at chemotherapy, surgery.
Okay. What are some possible side effects caused by cancer treatment?
Yeah, so some of the most common side effects, especially from chemotherapy, very similar to people, you're looking at nausea, weight loss, and then some bone marrow suppression. So that's why if you do go to a veterinary oncologist and you're doing things like chemotherapy, they're going to ask for blood work pretty much every month. Other things too, if they're going through radiation therapy, there might be irritation at the radiation site. And then obviously if we're doing any surgeries, you're looking at, pain at the surgery site, infections, that kind of thing.
Okay, well, thank you so much.
You're welcome.